Director of Public Health, Dr. Helen says the GHA is looking at how the screening can be expanded, but without compromising the standard currently on offer.
There is a good reason and evidence base why we would want to do that. Bowel screening is all about trying to detect cancer at a very early stage before people have symptoms. We're aware the UK has lowered that age offer down to 50. Our current programme is 60 to 74. We offer people a bowel screening kit every 2 years, but we have to think very carefully and plan that expansion of the bowel screening programme, taking into account the resources we've got. By that we mean what then happens when people have positive tests. Have we got enough lab capacity? Have we got enough colonoscopy capacity? Have we got enough gastroenterologist capacity? Whilst enabling us to deliver safe programmes. We're very proud of the programme that we deliver currently, and this is why we're actively looking at and exploring what would we need to do to essentially double our screening offer.
The main aim of the screening programme is to identify bowel cancer early when it's easier to treat with much better outcome. The screening programme also allows doctors to stay ahead of the game with an almost preventative strike.
Another major benefit is the detection of polyps. These are small growths within the bowel. And whilst there are some polyps that are harmless, a lot of them have the potential to become a cancer. These are precancerous lesions. So we spend a lot of time looking for identifying and removing polyps before they can become a cancer. About 65% of patients who we carry out colonoscopies on for the bowel cancer screening programme have polyps that we can remove. We take them away, we get them looked at under the microscope, and by removing that polyp can no longer become a cancer. The patient leaves the endoscopy room with a lower cancer risk in the future. So both detecting early but also removing polyps that could become a cancer down the line is a major benefit to the programme.
But of course, there are steps we can take as individuals and our own lifestyle choices.
In Gibraltar, smoking is very common. It does increase the risk of bowel cancer. That's something that a lot of people don't realise, and something that I think we could make a big difference with. Smoking is quite a significant problem within Gibraltar in terms of the number and the age of people taking up smoking. And at this point in time, whether vaping is significantly better for bowel cancer, I don't think we have that data yet to say. Looking at a healthy diet overall, trying to avoid the excesses in both that leads to things like constipation, for example, will also have a benefit. Healthy lifestyle, it sounds boring, we repeat it as doctors again and again, but it does have an impact. And I think certainly from a dietary point of view, smoking history, these are big factors that we can do something about.
If anyone has any symptoms or concerns, they should make an appointment with their GP.
So blood in the motions is the main one. So if you've got blood in your poo, this isn't normal, this is something that needs to get looked at. In the majority of cases, it's probably something fairly innocent. But until you've had it looked and checked up, you don't know. Change in your bowel habit. There are lots of things that can cause a change in your bowel habit, but until it's looked at, you don't know. So a change in your bowel habits, blood in your motions, and a tummy pain that is different on you to you. These are all things that you'd want to be aware of. Unexplained weight loss, a change in your appetite. Again, things that can have a lot of innocent reasons behind them, but need to be looked at.